The other issue that Boris Johnson feels he needs to talk about is fixing the NHS. For example, on Tuesday, Adam Bienkov from Byline Times reported this. Boris Johnson's spokesman said the Prime Minister will transform the NHS into a, quote, blockbuster healthcare system in the age of Netflix. Asked repeatedly to explain what this means, Johnson's spokesman is unable to say which features of Netflix he believes the NHS should imitate. Adam Bienkov does go on to clarify. He says, to be clear, Downing Street's currently like Blockbuster. Not that they want to be like Blockbuster. That's the defunct video rental chain, of course. And the Health Secretary wants to bring it into the Netflix age rather than they want it to be a blockbuster. So it makes ever so slightly more sense, but it still seems completely empty. Blockbuster became unnecessary because technology arrived, which meant people could just stream videos from home. They didn't need to go to a brick and mortar shop, but people still need to see a GP. They'll probably always need to see a GP, and there's no sign we can start getting operations from home. So I don't see how the analogy works. And it happens to be an awkward week for the Tories to be going on about their management of the health service. This widely shared video was shot in an Essex A&E department on Monday night.
We've currently got 170 patients in the department. That's 170, quite a few. There are 90 patients waiting to be seen at the moment. That's 90 of you are still waiting to be seen. Our current wait time for a doctor is 7.5 hours. I will estimate that by the time I go home in the morning at 8 o'clock, some of you will still be here waiting for a doctor, because the wait will get up to 12 or 13 hours. I will expect that. There are currently no beds in the trust. We're trying to make some space if we can, but if people are admitted, there is a chance they might stay in A&E for the night. So we will make you comfortable, we will do our best, we will look after you, but please don't expect that you'll be going straight to a ward, because that may not happen. If anyone is feeling particularly unwell whilst they're here, please let the girls at reception know, and they'll escalate to us. We'll make sure that officers get whatever we can do. Anyone here with relatives, can I ask you to leave? Because obviously we're running out of space. We're still trying to social distance as much as we can, and this is not social distance at all. So any relatives that are here, if I can ask you to go, unless the person you're with has any kind of dementia, communication like that, or is a minor. Right.
So what you were told if you went to accident and emergency in Essex on Monday night was that average wait times for a doctor is 7.5 hours. That's average wait times. She said for some people, the wait will get up to 12 or 13 hours. This is people going to A&E. She also said there are no beds whatsoever in the trust. So if you need to be passed to a different department, you're going to have to wait probably even longer. And this, I think, is what really got me. While you're waiting, your relatives have to leave. So you're in A&E, you're normally in A&E because you're in some sort of distress. It's not normally a nice place to be or a nice context to find yourself in. You might have to wait 12 hours and you'll have to do it on your own. Now, it's important to say this is clearly not because this particular healthcare worker, nurse or doctor or whoever she was being harsh and cruel. This is because the NHS is close to collapse under pressure. Health Secretary Sajid Javid was played that clip, and this is how he responded.
Of course, that's not anything that anyone wants to see, and I can obviously see the nurse I'm talking to you down the line, but whether it's her or everyone else working in the NHS, I want to thank them for all that they're doing, the incredible pressures that they're facing. For A&E, unfortunately, because of the impact of COVID, when we know already from our NHS estimates that we think some 11 to 13 million people stayed away from the NHS because of the pandemic. Many of those people are coming forward, many of those to A&E, and we're seeing very high levels of demand, and that is a real challenge for the NHS across the system.
That was Sajid Javid blaming long waits on the pandemic. And of course, I have no doubt that has played a role. There's some important context he didn't add, though, because the crisis in the NHS predates COVID-19. This chart shows how much annual spending has increased on the NHS under different governments. Between 1949 and 1979, there was an average annual increase in the NHS budget of just under 4%. That went down slightly under the Thatcher and Major governments and hit 6% under the post-97 Labour governments. Then the coalition government comes in and those increases plummet to below 1%. And after 2015, they go up to only 1.5%. So historically low investment if we're looking at funding increases. That's, of course, important because the number of people who need the NHS sort of goes up every year because of an ageing population. The effect of that funding squeeze was this. This is how the number of people waiting for treatment changed under the Lib Dems and the Tories. As you can see, Gordon Brown's government got the number of people waiting for treatment down to just over 2 million. As soon as the Tories came in, it started increasing until it reached 4.5 million when we were hit by COVID. So that's before COVID hit. So NHS backlogs had doubled without COVID-19. This is a Tory problem and a Tory Lib Dem problem, actually. It's not a COVID-19 problem. Finally, as well as comparisons over time, we can do comparisons across countries. This chart shows the number of nurses and doctors relative to a country's population. As you can see, Germany has coming up for twice as many nurses per 1,000 people as the UK, and France has about a third more than we do. When it comes to doctors per 1,000 people, we are worse off than all of Germany, Italy, and France. And that continues when you increase the number of countries the UK is compared to. We are well below the EU 14 and the OECD averages. Those are the purple bars. And we are absolutely put in the shade by countries like Slovenia, South Korea, and Australia. It doesn't have to be like this. We're not a poor country. There's no reason we shouldn't be able to train more nurses and more doctors so people don't have to wait 13 hours at A&E. And this is the issue. It's not, can we make it a Netflix? It's not, can we make people treat themselves at home? Because that would actually be a horrible way to do healthcare. It's, how do we have more doctors and more nurses so there are more doctors and nurses to see people and they don't have to wait all that time, right? It's not rocket science. You squeeze the funding of an organization and it starts to work much less effectively. And when the organization we're talking about is the NHS, that's going to cost quite a lot of lives.
The fact that the thing is being run into the ground, it's certainly amongst their legacies. I mean, the trouble is with the Conservative governments we've had, Conservative-led governments we've had since 2010, is that there's a whole series of basically disastrous legacies that they've managed to produce. I mean, one of the reasons the NHS is under such pressure, it's not just that we have an aging population, we're ending up with an increasingly unhealthy population as a result of things like austerity, as a result of which you can start to see, for instance, life expectancy was falling even before COVID-19 hit. I mean, this is in a rich developed countries after decades, literally, of life expectancy improving as people's health in general improves, as things like the NHS do their job, as diets improve, as people work differently. That's what you'd anticipate happening. And now life expectancy is falling. So that crisis is then entering into the NHS. You've suddenly got more unhealthy people around. You've cut other parts of the system. You've cut universal credit funding. You've cut various other bits of the welfare state. You've cut dramatically public health funding, which is supposed to be one of the things that's going to act as a preventative spending to prevent people becoming ill so they don't end up in the NHS. And the only thing, the system that's still kind of working in the middle of all this, because it's so frankly politically popular that people appreciate the NHS and they want it to stay there, and it's the only bit that's still kind of running, is the bit that has to deal with the crisis elsewhere in society. Social care is the same thing. Social care funding has been run into the ground. It's in a desperate state even before COVID-19 hit, and it's the NHS that has to clear up the mess from that. So in order to get the NHS working, you kind of have to solve all the other minor or major disasters that the Tories have caused in the last sort of, it pains me to say this, in 2010, it's over a decade now that we've had this. And that's partly why the NHS is under such strain. Fix these things, or start to fix these things, get social care working properly in particular, the NHS starts to look in a better place. But you've also got to bear in mind, I mean, Sajid Javid does not strike me as a natural fan of the National Health Service. This is a guy who every Christmas, the story is he reads selections from Ayn Rand, the libertarian author, to his, I'm sure, long-suffering family. You know, this is not someone who's naturally inclined to think, hey, let's have a big government-funded public health provision that's free to everyone. This is not really where they're sitting. And there's a slight suspicion in all of this that actually, if the NHS is steadily undermined, if people aren't so committed to it over time, in the longer term, this isn't so bad for the Conservatives. And if you take a very long-term kind of ideological view of what government might be doing, then perhaps you could steadily get rid of the NHS. And if it's being run down and people are abandoning it and going private if they can afford it, or just generally deciding it doesn't work anymore, that's not such a bad thing. You saw that happen under Margaret Thatcher. Support for the NHS started to fall as the NHS was being somewhat run down. It recovers under Labour because they do, as your graph showed, put some more money into it. So, of course, the thing improves. But if we're in this stage where it's being run down, then perhaps in the long term, the Tories might think, do you know what, it's not such a problem for us because people just don't believe in the system anymore. So it's important we fight for this. It's important we fight for the funding, not just for the NHS, but right the way across all the other messes that austerity in particular has created in the last decade or so.
All of us here at Novara Media are working harder than ever to keep scrutinising establishment politicians and the media barons who protect them. We don't have billionaire funders. We don't have advertising partnerships. We're funded entirely by you. If you've ever thought about supporting us, now's the time to go to novaramedia.com/support and donate anything you can from just £1 per month. Defy the corporate media. Join our monthly supporters and help build our supporter base to 10,000 strong.